Thank you everyone for attending this. We're really happy to be able to share this information with you. I'll be presenting the first part of this deck, and then Amy will be jumping in, and then we'll both be on. We really appreciate the opportunity to share this information. This is not meant to be salesy. This is meant to share this information, but just for some context, for those who don't know Zeldis Research, we're a primary market research firm. And one of the areas we specialize in is insurance, and within that, a real focus for us is health insurance, and that's sort of what led us here to this topic of telehealth for behavioral health. As part of that, we do self-sponsored research on emerging issues, so that's why we're in a situation where we can share this. This was not research for a client, and it wasn't proprietary. We funded the research. So we're able to share it broadly with everybody. And as part of that, we do these kinds of studies 2 times a year or so on different topics. And we tend to reach out to partners, prospects for sort of crowdsourcing ideas. And we did that as part of this research also. In addition to what Brad mentioned before, we are happy to share the deck after the presentation, or to have a one-on-one conversation about our other capabilities. But just to jump into it, telehealth for behavioral health, is it here to stay? Sure, there we go. So it was really, the pandemic as a backdrop that got us interested in this topic. We'd had a long-term interest in telehealth, and we began to notice more and more interest in teletherapy, or telehealth for behavioral health, that for this discussion we'll call teletherapy. That it's become a real area of focus and interest, both in the news media, like you can see here on this slide, but also within the mental health community. We started to hear about it from colleagues, family members, and also notice articles in the New York Times, NPR, different professional associations, and that buzz really prompted us to want to do some more research into it. Some of the sort of technical things we'd started seeing, really caught our attention, like CMS has been able to share information that almost 500,000 Medicare beneficiaries have had teletherapy, at least as of August. And that's not using telehealth, that's literally teletherapy by the end of August. So that's that older segment really engaging in teletherapy. And then we know for the younger segment, for example, Teladoc, has also reported that their age 18 to 30 members really doubled their teletherapy visits early in the year in March and April. And we've also seen from the Department of Veterans Affairs that over 300,000 vets have used teletherapy again as of by the end of August. So it's been happening out there. And given that it's happening, we're also interested for our health insurance clients in understanding the impact of behavioral health on medical health, and understanding that a lot of people with behavioral health issues also have co-occurring medical conditions, and how tackling behavioral health issues can help with medical concerns. So for all those reasons, we really wanted to understand what's happening with the transition to teletherapy, and will it stay? So to get right into it, what we did was, in late June of this year, we did 20 one-on-one depth interviews. Half of those, 10 were with consumers who are all currently in teletherapy. 10 were with behavioral health providers who are currently in practice. And we targeted these interviews since we couldn't fund more than 20 interviews. We couldn't go out and try to do everything, so we had to make some choices, and we chose to focus the interviews in parts of the country that had been hit hard already by this time in June. So we focused on the Northeast, Mid-Atlantic. We had some luck recruiting one therapist in Michigan, but it's basically focused on the Northeast and Mid-Atlantic because by June, both providers and consumers had gone through a really challenging time with the pandemic and had to adjust, their businesses and their lives to the pandemic. And now we're starting to open up in June, and we were curious, how did they move to teletherapy? Did they continue with teletherapy as of June, and so on? So that's where we focused. the providers in our study, they're all psychologists and counselors. We had to make a choice. We didn't include any psychiatrists. And the only reason is psychiatrists are just more expensive. It's a different segment. So it's psychologists and counselors who we spoke to. Most are in private practice. A few are in an outpatient hospital setting. Some were in network with carriers and others are not. They're completely out of network. So that was interesting to have that mix. Among our consumers, all of them have employer-based health insurance. So a limitation there, but we had to make some choices. So they all have employer-based health insurance, and we had a good age range. The median age is about 38 for our consumers, but the range was from as young as 21 to age 50. So we thought we had a pretty good variety there. All of our consumers were currently in teletherapy, and by this time, when we talked to them, they'd had 6 or more teletherapy sessions, so they had something to speak to at that point. One of the things we want to understand was their thoughts about teletherapy before the pandemic, and essentially, they were not optimistic, not hopeful, not interested. Both the providers and the consumers were not terribly likely to use teletherapy as opposed to in-person therapy prior to the pandemic. They had a variety of concerns that we'll touch on, but there was nobody who was particularly excited about teletherapy at that point, and that changed very quickly, and we want to give you a feel for that. So about making that move to teletherapy, we have a couple of quotes, one here from the therapist perspective, the provider perspective, and the next one from the consumer perspective. But this captures what the therapist thought. As of mid-March in the Northeast, they just transferred everything over to telehealth, and they felt gratitude, really fortunate that they could have therapy as an option so they didn't have to discontinue providing service. So for therapists, it was something they felt really grateful they could do at that point. For consumers, the attitude was, I need something, and this is better than nothing. So it's not a real strong endorsement going into it. I was needing a program to support me during this time, and it was only being offered via telemedicine. It was that or nothing, and nothing wasn't enough. So not super strong confidence going into it, which is interesting, and made us think a lot about what the takeaways would be when we talked to them about their satisfaction and so on. That shift to teletherapy was really swift and consistent in the Northeast and Mid-Atlantic, essentially. As of March, the therapists essentially had to make this move, and nearly everyone had made the move by the end of March. A few therapists tried to see certain patients in person for about a week and then stopped that. The one exception that we heard from switching over 100% to teletherapy was among a subset, a very small subset of providers, and these are neuropsychologists. These are folks who work with people with head injuries, memory problems, brain diseases, movement disorders, and part of what they do is they need to do testing with patients, which means they have to physically have patients manipulate things. They couldn't figure out how to do that through teletherapy. So they screened patients and took those patients who met the criteria and brought them into the office with all kinds of precautions. But everybody else had gone to teletherapy. And when they moved their patients to teletherapy, the providers didn't really mention any benefits or drawbacks. It was just something they had to do at that point. What was really driving providers was really just concerns for the safety of their clients during the pandemic, but also themselves and their own families. They simply didn't want to get their patients sick, and they didn't want to get themselves or their families sick either. For those providers who do take insurance, it was critical for them that at that time there were some changes about reimbursement from CMS. In this case, it was for commercial insurance, that the healthcare carriers made the decision to try to make teletherapy easier for providers and consumers. That was essential for the providers at this point. For the consumers, we heard a few mentions that not having a copay for teletherapy was a little bit easier and maybe removed a barrier for them, but they didn't talk about it as energetically as the providers did. That move to teletherapy was really handled in a very mass way, a very broad way. It was simply mass emails to their clients, phone calls or texts to some. It was essentially just a triage situation at that point, where nobody had plans in place for how to make this conversion. So it was a broad message to patients that this is how we're going to have to make this change, without a lot of cajoling about why this is going to be okay. It just had to happen. Sort of like when you think about how school systems were at that point. It was just a quick changeover without a lot of plans in place for how this was going to work. Consumers were just happy to continue to have an opportunity. One of the striking things we heard was that about 10 to 20% of clients opted out of teletherapy. And to our ears, that sounds like a lot. It's not an insignificant number of consumers who said, you know what, I'm just not going to do this. When we searched for what kinds of correlates there could be, the only thing that really stood out from providers' insights into this was really that those tended to be newer patients. We couldn't identify anything else about age, comfort with technology, what the particular reason for therapy was, anything like that. The best we could identify was really just, they were less established patients. And we don't know if those patients just stopped it because they weren't as involved at that point, as engaged in therapy itself, or if they decided to seek out a different therapist. We just know that those less established patients were more likely to be able to drop off at that point. We did have one patient who had not started therapy prior to the pandemic. So most of our consumers had been in therapy with an established therapist and then made this conversion to teletherapy. And we realized at this point we had one young patient, a 21-year-old, who had been in therapy before, but prior to the pandemic, she wasn't actively involved in therapy. She'd been thinking about it for a number of years, but for various reasons, she hadn't engaged. And the pandemic really helped motivate her, and teletherapy helped motivate her. We thought it was insightful how she talked about this. She basically said, having the time to myself because I'm not going into work and I'm not going into classes or anything actually gave me the kind of kick that I needed to start going again. So having that time, that downtime, which she didn't plan for and didn't want in some ways, also opened up the freedom and removed some barriers for her. And using teletherapy was also really natural for her. Therapists did have some concerns about moving to teletherapy. As I mentioned before, they were not excited about the idea of teletherapy. They really hadn't engaged in teletherapy before. There were some one-off exceptions. We had a few providers mentioned two situations. One is where if they had a patient who was traveling for work a lot and couldn't come in for inpatient therapy, that there'd been ad hoc times where they had done teletherapy for a patient who was traveling for a long time. A second situation from providers was if they had a patient who moved out of state and they needed time to find them another provider in another state, then as a bridge, they would continue seeing them out of state. And we had some consumers tell us that they had done this again ad hoc, against a woman who traveled a lot for work for really large blocks of time. She had tried teletherapy and had really honestly bad experiences with it. She had tried teletherapy by video in a hotel room and had lots of technical problems in the hotel room. And then she tried audio only teletherapy, but it was at an airport, in a busy airport, and had privacy issues. So she did not have a good experience at that point. But what we did hear from providers and what was in their head during this conversion was that they had a lot of logistical and practical concerns. And Amy will speak to some more of these a little bit later, but just the big issues were around privacy, understanding the platforms to use, best practices, technical issues. Like they had a whole hodgepodge of concerns. One particular concern that really mattered to them at this time was cross-state licensing requirements. You know, we had some providers who are on the border of different states, and they would see patients who just crossed over from, you know, Pennsylvania into Delaware, for example, or Maryland into Virginia. Or we had one provider who sees college students. So all these students are coming to school and they're from other states, and now they're in her state and she can see them. But when the pandemic hit, all those students went back home and now they're out of her state, and would she have to transition them to other therapists? So she was glad that at this time, private insurers relaxed some of those cross-state licensing requirements, and she was able to continue providing therapy. Same thing for our providers who saw people in other states, that even if they were in another state, they didn't have to take that drive and try to come in when they didn't feel safe. They could keep their patients and keep that relationship across states, and that was really important to those providers. We heard from providers about some of the platforms that they started to use. Almost none of them sort of had a ready-made solution, and they were scrambling to find solutions. The one we heard the most about was Doxy.me, and we heard about a couple of different versions of it, a free version, a paid version. Amy will speak to this a little bit more later. Some of them also turned to FaceTime. You know, at this time in the pandemic, HIPAA rules were relaxed, and there were many different technologies that were suddenly available. Providers mentioned Zoom. One hospital-based provider seeing patients in an outpatient setting mentioned Epic. We heard about therapy sites. And consumers mentioned therapy sites more often, mentioned Blue Jeans. One also mentioned another one called LifeSize. So for patients at this time, to try to find a therapist, most patients had that established relationship, so they just ported over to these platforms with their providers. We did have the one patient who was looking for new therapy at this time. She ended up using her provider portal, not a teletherapy app. She just went to her provider portal and the provider list, and she looked for therapists who would be willing, who said on the insurance website that they provide teletherapy. She went through a number of different therapists and sent them emails, and she had a therapist that got back to her. And what mattered to her was he got back very quickly. He was young. For her, being 21, that mattered as well. She said that he spoke her language. So that was really important. So she used a provider portal at that time. We had another consumer who had a therapist, but at that point was looking for some different therapy, and she tried using an app. She went through an app, got sort of an on-demand therapist, had a conversation, and both the therapist and she agreed that it was not a good fit. She needed much more intensive therapy than sort of a once-a-week teletherapy appointment, as she said, with a therapist that she didn't know. And the therapist helped her find a more ongoing situation. So that's a little bit of background about the transition. I'm going to turn it over to Amy, and I'll drive the slides to talk about sort of the effectiveness of teletherapy and what we heard there. So Amy?
Yeah, thanks, Jeff. So yeah, so Jeff's kind of set the stage in terms of what that transition looked like, what were both providers and consumers sort of feelings and thoughts and going into teletherapy and making that switch. And now we're going to talk about, you know, once they did it and it happened, how did they feel about it? So the next slide, Jeff, if you want to, we have a couple quotes. The first one here is from a therapist who you can see kind of might have been skeptical beforehand, but actually felt like teletherapy enabled them to connect with their clients more than they thought they would, and felt that it was an effective tool. And you'll hear that that's, you know, somewhat of a pattern in terms of what we heard. The next slide, we have kind of two quotes from consumers, kind of two different perspectives, and we'll talk about both of those. Up top, you know, you see a consumer talking about, you know, if they're not going to be able to get to the office and do this in person, they'd rather do it than not. but they still prefer in person. Whereas you've got the person at the bottom here talking about how their schedule is crazy, they're so busy, it's not going to fit if it's not teletherapy. So for them, they're really seeing the advantages of using teletherapy and kind of why it might even be better for them than in person. And when you look at kind of the overall reaction, Jeff, you can go to the next slide. You know, overall, people felt, I think Jeff referenced before, they were very grateful to have a solution, and they absolutely felt that this was a necessity during a pandemic, right? There had to be an answer. Both therapists and consumers do agree that doing therapy this way is different. But that doesn't mean it's worse. And so while we heard a lot about how it was different from traditional therapy in person, and we'll talk about that, what I think maybe surprised us a little bit is that we kind of heard two schools of responses around the effectiveness of teletherapy. One was, you know, this categorization of it as an 85% solution, right? So it's not quite, it doesn't quite get you what in-person therapy does, but it gets you most of the way there. The other group really felt like it was a 100% solution. They felt it was equally effective, if different, than in-person therapy, and it had, you know, advantages that they liked. So we kind of expected, you know, some people wouldn't like it, some people would. What we found was some people thought it was pretty good, and other people thought it was good, you know, very good. So I think that's a positive, and it speaks to the future of teletherapy as well. We're going to talk about some of, as we said, it is different, and some of that comes in the form of disadvantages, some of that comes in the form of advantages. So let's start with some of the disadvantages that people perceived from teletherapy or around teletherapy. The first thing we heard more from providers, but also from clients, is this idea that you don't have as much nonverbal communication and cues. So even on Zoom, at least you can see people's facial expression, but you're still not getting the full communication of body language. And of course, if you're doing it over the phone, you're losing even that. So that was something that we heard right off the bat. The next thing is that it might not, the effectiveness of teletherapy is going to vary on based on the situation. And so there are some situations we heard about, for example, severe clinical or neurological issues and young children. Those were two areas, or three areas really, because you've got the severe clinical, we had the people who did assessments and neurological assessments and felt like there was a need for in-person there. And then this idea that young children really, it's hard for them to focus and be engaged online for any length of time. So there are definitely situational factors, I think, that people recognize that maybe it works, you know, better in some cases than others. An important one that we heard kind of two different ways are privacy concerns. So first, even for the provider, the idea of I'm on Zoom or I'm on a video platform and my clients can see my background, right? If I'm at home, you know, maybe wanting to blind that a little bit, also making sure that I have a space, you know, that my spouse or kids are not going to interrupt a session. And then even more so, we hear that on the client side, right? So the ability to have a space where you can be comfortable, be open, not worrying about family members, overhearing things, disruptions from children, that's all a concern. I mean, we had one person, I think, who ended up doing a session from their car, and different people found different ways around this, but that's definitely a barrier or an issue. And then another big one, particularly for providers, was technology. That was an area that we heard pretty consistently, not having a go-to platform that they felt comfortable with, that they felt it was, you know, reliable, but also, you know, secure. Now, I think that has evolved a little bit. Actually, I just had a follow-up conversation with a provider friend of mine the other day, and I think Zoom has come a long way in terms of becoming more secure and a safe platform, and is very easy to use. Because she confirmed what we heard from a lot of what we heard in this research, that Doxy.me, while perhaps secure, had a lot of glitches and issues and wasn't reliable. So that was one of the biggest pieces that we heard about as a barrier. The last kind of potential disadvantage here is that, and this speaks to what Jeff was saying about how they had that drop off of 10 to 20% that tended to be, you know, their newer clients, is that a lot of people felt that teletherapy is more difficult in establishing a client-therapist relationship, and building that trust and building that rapport is more difficult to do online, and so is a potential disadvantage here. On the flip side, we absolutely heard there are distinct advantages here. The first one really comes down to convenience, that being able to not have to travel to a therapist's office. You know, in some cases, depending on where you live, the therapist that you want to use might be far away. If you have children in therapy, you know, driving multiple times, you know, when they have school and you've got work, it's harder to fit into your schedule. And, you know, Jeff gave the example earlier of the person who that was really a barrier to them even engaging in therapy, was kind of the difficulty, and teletherapy makes that much more convenient. From the provider side, you know, they talked about better show and compliance rates. They don't have cancellations. People are there, they're able to schedule it more easily. Some providers even talked about for themselves, right? Not having to commute to an office saves them time, gives them more flexibility in their schedule. We mentioned before that you lose out on some of the nonverbal communication, but one of the advantages is that you get some other cues that can be important and give you information and perspective. So, you know, we had different therapists mention, you know, being able to see the background, being able to see the patient where they live in their environment. One provider mentioned, you know, they saw their clients' children sort of interrupting them and interacting with their client, and that gave them a lot of perspective on some of the issues they had been working on. It was kind of bringing it to life. So I think there is a lot of information, both, especially providers found that they didn't expect, that they got a lot of additional information from doing therapy over video, especially. Another advantage, these two kind of go together, so, but access to that additional information, comfort for certain clients, and feeling like they're in a safe space. We heard that, you know, some providers and from some clients, that being at home, being in their room perhaps, makes them feel more comfortable, makes them feel safe, and that makes them more likely to kind of be open and engage with a therapist. Again, you know, I was talking to one therapist who talked about, you know, they've actually seen some deeper work with some of their clients over video, and whether that's because there's a certain level of anonymity, there isn't the pressure, you know, that being face-to-face. I think some people just feel more comfortable in that environment. And then the last is just sort of a counter, right? That it works well if you already have an established relationship. It's easier to make that transition and to keep things moving productively in that direction. Another thing, and this is, yeah, go ahead, Jeff.
Oh, I'm sorry. Just before we moved on, I just wanted to mention around that eliminating the commute, because I know you've highlighted this to me before, is just that it's different for teletherapy versus a telehealth appointment. That for telehealth, it may be a one-off ad hoc acute appointment for an earache, something like that. It's one appointment. For teletherapy, it's multiple appointments. It's every week or twice a week for a period of time. So the commute, the managing your job, finding parking, all of that is just it's just amped up for mental health, for behavioral health, as compared to, you know, a one-off medical visit.
Yeah, and I also kind of just a corollary, or another thing we heard related to kind of the time savings and the ease of not having to go back and forth to an office, is that, you know, it allows a therapist to potentially do 15 or 30-minute check-in sessions with their client, which in person is, you know, not as worth it, right, to drive to an office for a 15-minute check-in, but over the phone or over video, that's a lot easier to do. So one therapist in particular mentioned taking advantage of that. I also want to, you know, we didn't spend a lot of time with our respondents talking about group therapy, but just another kind of one-off potential positive. We had someone who had always wanted to try group therapy, but they had been nervous about it. They had some apprehension about being in a room with other people and feeling judged. And they felt comfortable during COVID, during the pandemic, to start a group therapy session, because it just felt a little less anxiety provoking online, right? They weren't as stressed about doing it online as they were in person. They saw that as a positive. And we did hear, of course, that, you know, Zoom works better for a group therapy because it's good to be able to see everybody kind of in one place. So kind of in summary of the pluses and minuses and the overall reaction, you know, there's definitely some technological limitations, or there were at first, but for the most part, both consumers and therapists have been very positive about teletherapy and felt that, again, it was either mostly as effective as in person or just as effective as in person. That said, you know, there are those barriers that we talked about, right? So the platform and technical issues, the privacy concerns are important. So, you know, there needs to be some compromises there that can make teletherapy less attractive for some. I should mention, in talking about the privacy concerns, what was interesting is we definitely heard that as a barrier, but some of our younger, with younger patients and younger clients, it seemed to be maybe less of an issue. There were some examples. One therapist mentioned she had a young client who, when they engaged in their therapy sessions, would just text her and say, oh, my boyfriend's home or my roommate's home, so don't ask about them. So she was fine doing the therapy session kind of out in the open in her kitchen with her roommate walking by behind her. So I do think there's some very individual variation on that particular issue. So kind of overall, you know, the gap may not be completely bridged for everyone. Providers and consumers really adapt and devise strategies to limit downside. And again, for some, we'll talk a little bit about kind of the future of teletherapy. It's actually seen as more attractive than in-person therapy. So let's talk about the future of teletherapy and what that means. Again, looking at kind of a quote from a provider, feeling like it's becoming normalized. People like certain things about it. It's flexible, they're finding it to be satisfactory, and it's opened up new possibilities that are here to stay. So, and I think that generally reflects what we heard for the most part. And then on the consumer side, again, you know, you have kind of different schools here, but for a subset, it helps them with convenience. They don't have to travel to the office. They can do it wherever they will be. It's just more convenient. So you definitely have a subset of consumers who really see this as more advantageous than having to go into an office. So what do we look, you know, what does it look like, you know, both more in the immediate, short-term, long-term? Yeah, there are some mixed, right? There are some who already were, when we did this research, looking to get back in person where they could, wearing a mask, socially distancing, disinfecting between clients, but were eager to kind of get back and had clients who were eager to get back. Others really feel like there can be this lasting impact on therapy, behavioral health, and how it's practiced that is likely a permanent, a sea change. And I think it will depend both on the provider and on the individual client. So I think we talked to some consumers who, you know, again, are eager to get back and want to, you know, see a therapist in person again. Some talk about that they'll wait for a vaccine. They won't be comfortable until there's a vaccine after COVID. But once they're in, you know, once that's there, they will be doing that. But others, you know, see as potentially continuing with teletherapy, you know, beyond COVID, post-COVID, because they see the advantages there. Moving to the next slide. Those who think it should continue, which I think, you know, most folks think in some form it should continue, really think that the support of insurance carriers and, you know, kind of policies are going to be really important. This is specifically a provider, you know, mostly a provider point of view. So, you know, clear message we heard from providers was that coverage for teletherapy needs to be commensurate with in-person therapy. There is an expectation that they should be reimbursed at the exact same level that they would be for in-person therapy. It's the same amount of time, it's the same amount of effort, and they're pretty consistent in that feeling. And then, as Jeff mentioned earlier, we had, you know, some therapists who were needed that sort of exemption to be able to provide care to people across state lines. So that's something that they're thinking about too. If that, and I think in some cases it may have already changed at this point. But to be able for them, the particular people we talk to be successful doing teletherapy, those requirements would need to continue to be flexible. In terms of, we kind of spoke to this a little bit, but we did push therapists on what their expectations were in terms of reimbursement, and they really feel like there's no different and it should be equivalent. And I think to some extent their expectations were that carriers might not feel that way, and that some carriers might try to reimburse them at lower levels for teletherapy, and that would not make it worthwhile to them. So really, the future to them depended on that level of reimbursement, obviously for those who take insurance in their practice.
And Amy, maybe that one exception that you mentioned earlier about sort of the 15-minute check-ins that might fit in differently, and maybe a different kind of reimbursement for that scenario.
Yeah, that was the one thing we heard. Well, okay, maybe there could be shorter session reimbursement. That would work here. That's right. We talked about earlier. Jeff mentioned the couple of folks that we had that had started therapy or looked for a therapist during this time, and one of them did use sort of that on-demand therapy and ended up having to go with a different solution because she had a more intense need. When we broached the topic of sort of on demand, where you go onto an app and you kind of like you do for telehealth if you need a doctor right away and just find somebody and have a session, most felt that there's really limited value in that, especially therapists. We're not a big fan, but even consumers thought maybe if there's an urgent need and I can't reach my therapist, or I don't have a therapist, right? I haven't established a relationship yet, that might work. But certainly, I think it would work better with an app or system where they could schedule an appointment, they could see the same person, which I think a lot of the behavioral health apps do let you do, where you see the same therapist week after week. I think that would make it more valuable. But in general, folks are not really enamored with the idea of finding a therapist in this way. Jeff, I know before we kind of summarize, I know you got some follow-up. We followed up with some of the therapists that we spoke to in the original research. I don't know if you want to share a little bit on what we heard in that follow-up, which was just in the last couple of weeks.
Sure, yeah. We were curious how things were looking in October, given that we originally had the discussions in late June. And so we were able to reach out to our providers. At 9 of our 10 providers, we were able to talk to again. And most of them, the majority of them, are still 100% teletherapy. They are not ready to be seeing patients until there's a vaccine. For those folks, like one perspective was, I could see patients, this was sort of the extreme, but I could see patients in person, but they'd have to be masked, I'd be masked. And if I'm concerned about losing nonverbal behavior, this therapist felt like I'd be losing even more nonverbal behavior talking to a patient with a mask on than I would seeing them over Zoom. She also just had a lot of concerns about safety for her patients and herself in that situation. And that was by and large the majority of opinion. We had one or two therapists who said they've started seeing patients, about half their patients in person, and partly pushed by the need for those particular patients. And one therapist that actually just recently held a group therapy session outdoors as a way to sort of manage safety concerns. And her reaction was like doing teletherapy and then trying to manage in person was challenging for her. It was almost, extra work. And that may be just something, it may just be new on the learning curve. But I think the main takeaway for us was maybe a little bit surprised is that in late October in the Northeast Mid-Atlantic, most of these therapists were still, forging ahead with teletherapy and had not pulled back either for their own reasons or their patients' reasons.
Yeah, absolutely. Okay, so we have a couple summary slides, just what we talked about. So obviously, the pandemic has resulted in a just complete explosion of teletherapy in the behavioral health space. Professionals are leveraging different platforms. That's been a challenge in terms of, which to use and which maximizes both reliability as well as security and stability. Really good news that both providers and consumers agree that teletherapy is either fully effective or mostly effective. Really much more positive, I think, feelings than they went going in right beforehand when we talked to them about what they worried about or what they thought about it to what they actually experienced. So it's a really positive story there. Health insurance reimbursement is critical in terms of the future of teletherapy and continuing to kind of optimize and capitalize on this move and this experience. I think that's going to be really important. But in any case, the future of teletherapy does look like it's going to be here to stay. I think it's just a question of how often and how it's used and in what situations. But I think, the fact that people were forced into it allowed them to see that it can be a really useful tool going forward. And then a couple of sort of takeaways for some of the, health insurance companies that we found. Jeff, if you want to go to the next, you have the next slide there, yeah. So, we were asked by some of our partners in the health insurance space, what does this mean for them? Obviously, we've stressed it a lot, reimbursement, and some of our, we've talked to some health insurance partners who that's always been their model, that they've reimbursed the same for teletherapy as in-person therapy. So that's great, they're ahead of the game, but that's something that I think is going to be really important to continue. Technology is the other piece. I mean, I think there's room, there's space there for a secure, reliable platform that is focused on therapy as opposed to, just kind of tangentially used for it. So I think carriers could consider stepping in to fill that need, or at least help kind of evaluate and recommend the best technology that's out there. And the last piece is training. So, we heard that behavioral health providers, this was all new to them. And to them, there are different skills and there's different strategies in teletherapy versus in person that they felt that they were not really prepared for. So I do think, we heard that there is room for best practices in teletherapy, whether it's technology and logistics or really, clinical care and gold standard for that. So I think a health carrier is a logical source to help bridge that gap in providing standards of care, training on teletherapy best practices. It could be in partnership with professional associations, but I do think there's definitely a space and opportunity there for a carrier to step in.
Yeah, and I think I'd add one other thing that we heard, Amy, we talked about is, one of our clients sort of highlighted this for us, that, we got a very clear response from both consumers and providers that they were skeptical about on-demand or telehealth apps or teletherapy apps. And one of the reasons it seemed to be was that they need more education about what a teletherapy app can provide. They immediately thought of them, our consumers and providers thought of them as like telehealth, where you're essentially getting a random doctor each time. And they need to be educated that there are different models and that having getting channeled to a consistent provider is possible through some of the teletherapy apps. It seemed to be an important educational opportunity.
Yeah, absolutely. So I guess we want, open it up if anybody, I didn't see any questions in the chat yet. I don't know, Brad, if any questions came in or.
Yeah, we do have a couple questions for either of you. What do you think health insurers should be thinking about to help teletherapy be successful?
Sure, I can start that one, Amy. A couple of the points, it kind of brings back to a couple of the points we were talking about. One is around parity for reimbursement, that providers are certainly expecting that. And when we tried to push them about whether or not there are any savings, if they're not in their office, real estate concerns, things like that, they, it's in their interest, but they push back really hard. Some of them even saying, this is even harder. There's Zoom fatigue for us as therapists. We're paying so much more attention to ourselves and our clients, constantly looking at each other, and learning new skills doing therapy that way, that they really pushed back about their willingness to participate in this if it was anything other than parity. So that's one main takeaway, and maybe part of the other, I think, is the education around how teletherapy apps can work, and maybe appreciating that for many people looking for therapy, it's a longer term relationship. It's not a one-off crisis situation, and understanding that teletherapy can work towards creating an established long-term relationship that's different than what they may have experienced if they've been using telehealth during the pandemic to, treat their child's earache or a skin rash or something like that. Those are a couple of the ideas. Anything else, Amy?
No, I think that's really good. Yeah.
And one more question. What do you wish you could have asked or included in the research that you didn't?
I think one thing that's come up in a couple times as we've walked through this with folks is, it would be great to talk to people who are newer to therapy, who are looking to start therapy, right? Because almost everyone we talked to had an established therapist and just made the move. So I think really exploring folks who are looking to find a therapist in this world and in the world of teletherapy, how talking to them about their experience and how they would go about that, and to Jeff's point, their openness to, if they can talk to the same therapist instead of being able to do it through their insurance portal or an app. I think that could be an interesting area of exploration. Jeff, how about you? What else did we wish we had asked?
Just to piggyback on that, the opportunity to increase access to therapy for so many people by using teletherapy is a great positive, and really understanding how people would start those relationships would be really valuable. And given the audience we talked to, we didn't get to delve into that quite as much. And we heard the second thing related to that is we heard a little bit about the stigma, but that would be another big question I wish we could learn more about, is if people feel more comfortable. We did hear about that a little bit in a couple of ways. We heard providers say that for some of their adolescent, teenage patients, they felt like they were more comfortable and maybe more willing to open up in their own home space. They're used to playing video games and being home in their bedroom, and they almost seemed like they were more comfortable having sessions there than coming into the office. And Amy mentioned the one person who was willing to try group therapy because it was over Zoom, and felt like he would be less judged than going into a room with people. But those sort of stigma related issues would be interesting to explore some more, all wrapped around the idea of, can teletherapy really overcome some of the access issues that
right
exist?
Yeah, I mean, that's something we weren't able to address, is that the potential for teletherapy to expand access, both from a geographical standpoint of where you live and how close you are to the nearest therapist, and as Jeff's saying, in terms of people who, there's just a stigma barrier or a fear barrier that maybe teletherapy lowers the bar. And I think so going out again to people who maybe are newer to therapy in this time frame, and or providers who are starting to onboard new clients during this period, and how that experience is going.
Mm-hmm.
Great, thank you. And then lastly, do you have any plans to do this type of research again?
We don't at the moment. I think we'd love to sort of circle back and have a more in-depth conversation now or next year. We'd love to find a partner who was really interested in that, and even exploring some different audiences like telepsychiatry and some of the other consumer audiences we mentioned. So we hope there's an opportunity to do that in the future.